Maybe a little both.
Man. Okay, that is 104. She has a missing incisor. 2 missing incisors. 401 and 402 is missing.
Yep. Oh, I might have come unhooked when we roller.
Is there anything I can do during this procedure today to make this pain go away?
That's a good question.
Can I extract it while we're here?
Oh, that's a good question. So we've got to think about the pros and cons of extracting a tooth during a step.
It's very mobile.
It is.
Like, I don't think I'm supposed to be able to do that.
It is mobile. I guess the what you can touch is mobile. The question is there more like root deeper that's not as mobile? So the positive things about removing it today would be that we get it out of there and we help her promptly. She's already under anesthesia, so we see a very anesthetic event. The cons would, what kind of negative things or things the owner might want to consider about doing it today?
Cost?
So a little additional cost. And it's like time. Usually doing dentistry at the same time as a an abdominal procedure isn't like our goal, just because of the risk of infection.
But it wouldn't be scaling.
No.
It would be extraction.
Yeah, I feel like in this case, it's probably okay. If that's all we're doing in it. But if it doesn't come out in like one piece, and then we need to go bring her in there, use her rest, make a flap, that's fine. It could just extend time. And I mean, I'm not trying to talk you out of that. I'm just going through everything that's in my head. I think we should try to take it out. Do you?
You can call the owner.
Yeah, I was gonna say.
Do we know how much it would cost?
No, probably not. Really? I can find out.
I feel like it's so mobile. I feel like I could extract this out.
I think so too, but let me find out what. I think having a number for a price, it's gonna cost something. So let me find out how much it's gonna cost. Marisol?
Marceau. She's French.
You're French? I think you can extract it too. I always think like worst case scenario, because that's what happens. Okay, 2.
I feel maybe unreasonably.
No, I love it. I think being like,
I don't even think I would need a clap.
I hope not. Either.
And I do need to record the paint too in there.
I was going to ask about that.
Yeah.
So hopefully it would just be like.
Since this is like our dirty.
Which seems like overkill for, you can even probably do half of that, so probably like around $100. Okay, I'll call her and I'll get you some dental stuff, okay? And then would you want to block that? I mean, I think you're going to be removing a lot of the pain by extracting it, but something we can do for her.
I guess theoretically, the only block we do in cats is like the very back, right? So I'd be blocking her whole mouth.
Would be blocking the whole arcade, yeah. But it's easy to do.
Okay. What's it called? Just a caudal maxillary block?
Yeah.
But that would cost more money, right?
Not very much. It's probably like $10 or something, right? I mean,
Okay.
is she financially conscious? Like, is it a concern for her?
I don't know, but if I tell her a price and she's not good with it, I'd rather get it out
And then tell her the price?
than I'd rather get it out than not get it out.
Yeah.
That's
Yeah.
a very spectrum of care
I totally get
thought
that.
process, and I like that.
And we're going to make it happen. But because we need to help this cat, but we also do need to be charged for what we're doing. And so like, in some situations you don't have to, but I think this will be actually a very inexpensive way to accomplish this. But the kids actually fell asleep on the basement floor, and it's like not a finished basement. It was somebody's something.
Mm-hmm. Ah. I just don't like this hair. Oh,
Don't like
and
that.
then after that, then the final straw was smoking a vape pen in the break room and setting the fire alarm off. And I was like, ugh.
We had somebody do that in our bathroom.
Here?
No. Where I used to work.
It's just crazy to me. Like, also, you already knew you were on thin ice. Why?
Why would you make it worse?
She did not make some good choices. So hopefully she's making better choices. But I just want to let you know that.
Has she seen you yet and like recognized you?
I don't know that she recognizes me.
Okay.
But I recognize her.
Yeah.
There's another student that comes through that I recognize too that did some shady things in my last clinic as well. Yeah.
I
One.
mean, some of the vet students have sticky hands because
Uh-huh.
I was involved with a tailgate last year that
Yeah.
we did for like with Banfield for the vet students,
Yeah.
and I had a like Script Ohio homage sweatshirt that I took there. Somebody stole it.
Well, and then I
It was
had
gone.
my stuff stolen here.
Yeah.
Like my.
Oh, yeah.
I'm surprised my stethoscope hasn't been stolen.
Yeah.
That's
but,
because it's a
like,
requirement for school to have
my
one,
goggles,
so they all
that's
have
true.
one.
Yeah.
My stoggles, my bandage scissors, any nice pins that I have,
Yeah.
all stolen. And then, do you want his like prepuce shaved or no?
Probably not.
If I put a hand on him, will you give him a breath? He's just still not doing very well on his own.
Yeah, the other one did a belly tap without a doctor present
Oh, yeah.
as an assistant. And I was like, huh? You did what?
That happened with one of the vet students that graduated, not this past year, but the year before. But
Yeah.
she didn't pass boards 2 times, and she didn't tell anybody that she didn't pass boards.
No.
So she was like doing stuff as a doctor, and nobody realized that she wasn't technically licensed.
Yeah. Even technicians shouldn't be, you know, like,
Yeah.
or like, even as an assistant, you shouldn't be
Yeah.
doing things that technicians should be doing without.
Yeah, like she.
No, it's illegal.
She
Yeah.
created quite a name for herself.
I'm
in
sure.
Banfield because of that.
Yeah, this one when she did the belly tap. I don't think the doctor even knew about it.
That's just ballsy to me. Why would
I
you do
know.
that?
She also multiple times administered incorrect medications to boarders
Oh my god.
and did not say anything. I did it once, like I didn't do it, but
Yeah.
the dogs were kenneled together and the other one just
Yeah.
like it coughed it up. I thought it had eaten it.
Oh.
And it coughed it up and the other one just gulped
it.
it down. And I immediately took that dog to a treatment room and was like, what do you want me to do? You know, like,
Right.
shit happens.
That's one thing.
But you have to say something because at that point, like, it's no longer just, you know, obviously you're going to get humbled, but at least the patient is taken care of, right?
That's why I felt bad. Before I got the job here, I was interviewing another clinic, and I walk in for like my first interview, and there's a technician there that we had basically fired that was working there, and I was like, hey.
Hey!
Yeah, and I was like, fuck, she's gonna run her mouth because she knows a bunch of people I still work with, so I'm just
Right.
gonna fucking run her mouth. So she like I went back for a working interview, and their practice manager was like, oh, so like, it sounds like you know Kaylee, and I was like, yeah. And they're like, what did you think of her? And I was
Can you
like,
breathe for him again?
I was like, well, we literally transferred her to 3 different hospitals, and she had issues with all 3 of them.
Oh, shoot.
And he's like, yeah, we're like in the process of firing her.
Oh, no.
I was like, oh.
Oh, no.
Because they had I guess like a 3-month like trial period or something.
Yeah.
Or, like, it was either 3 or 6 months where they were like basically could like end employment.
Yeah.
After that.
Without, like,
Yeah.
question.
Yeah.
Oh, my God, that's
I
funny.
was like, ooh.
They were like,
She worked here she worked not here, but she worked, I guess, over at Large Animal for a while too, and got
really?
fired as one over there too.
That's crazy.
Yeah, he's an adult. Hold on.
You got enough blood for the Portland test, right?
Yeah.
Okay, great. Don't.
Good. Okay.
I hope that's on video now.
It is.
Good. Yeah,
He's playing with his hair.
I know, I was like so floofy. Should I leave that? Or, oh,
There's one long one. Maybe okay.
you want it off?
Sure. Yeah. Okay.
Okay.
You want to do the block first?
Yes.
It's over here.
So he has do you want the incisional, like,
Hold on.
before sewing skin?
You what?
Do you want the incisional before sewing skin?
Yeah.
Okay. So we'll leave that one. And then this is the testicular. And you want, what is this, 1 point?
I think we should do the gastropexy probably first.
Is that what you want to do, a line block
Yeah.
first? Okay.
You haven't done
I've done a line block before.
Okay. Let me show you.
Yeah.
Okay. I'll do the first poke and you can kind of see what it looks like.
I've seen them. I just have not done it before because we
Okay.
did them for our C-section.
So literally you kind of assume where that incision's gonna go.
Yeah,
And
you
you just kind of go
a-
like right into the skin right there. Pull back, make sure you don't have any blood, and then you can just literally inject it underneath.
Okay.
You just
And
literally go
down
the
a
whole
line.
way down.
Okay.
Yep. So, and you'll know you're in the right spot because you'll get like a bleb like that too. There you go. Pull back. Good. See? And you got a nice little bleb. Some on the skin doesn't hurt too.
Right.
Beautiful.
I know. We did ours with like lidocaine, glyco, and cefazolin maybe.
Oh wow.
Really?
Huh.
It was weird. It was a
That's
weird
weird.
mixture.
Yeah, it's a weird combo. I've never heard of it doing it with cefazolin or glyco.
I don't know why they did it that way, but
Yeah.
and maybe it wasn't. Maybe it was like ampicillin or something, but
Matt needs an adult too. Hold on.
Jeez, these students.
I'm coming.
Thanks, I didn't want to interrupt.
He's so sweet.
your belly button is thick. Your belly button's gonna be numb.
All right, buddy.
That's done.
Can you give him?
Want me to give him a breath?
Can you give him a breath?
Yes, I can.
He's still just not breathing.
You ready?
Okay.
Ugh, your belly button is gross.
It is kind of weird. It's really low down.
He's got an
too.
innie.
Yeah.
He does, and he has a bunch of dirt inside of his innie.
Ew. He does. Sorry, buddy. Alright. Well, I got the crud, so now we'll do our face straps.
You're doing great.
Get off. Get off. I like these gloves.
Yeah, they look nice.
They're new ones that we got, I don't know, like maybe last week or so. They're nice and thin, like the lavender ones.
This is our first and last time ever seeing these gloves.
Right? Like, we're not ever
I
gonna see them again.
hate the lavender ones in dentistry.
Oh, really? The thin ones?
Yeah.
I would
bust
agree.
through. I bust through them in dentistry.
I would agree with that because they do like I do bust through them.
Yeah.
If I'm doing something that's like kind of heavy duty.
Yeah.
But I do like them for like feeling for things.
Yeah.
So like anal glands, I love them
Yeah.
for anal glands. Sorry, buddy, I made your belly button bleed. It's probably where I gave that block because I
Yeah.
did give it in his belly button.
Is that weird?
Mhm.
Why does it say that the battery's almost dead on it?
Because it's not plugged into the wall.
Why is it
Oh,
not plugged
cool,
in the
cool,
wall?
cool.
I don't know. I realized that like a few minutes ago.
Huh.
And I thought to myself, why would you do that?
Oh, buddy, your poor belly button. Sorry. At least I didn't do that.
True.
That was you.
That was me. That's how you know you got a good one.
As if you made him bleed.
Yep.
It's these damn doctors, man.
Yep. Same thing with nail trims.
Oh yeah, it's a good trim when you made him bleed, right?
Here, can you hold this? It'll be easier so I can give him rest when I want to.
Feeling like I'm not getting this rinse puff. I'm just getting a lot of suds.
Do you want more Zephyrin?
I got alcohol because
Oh,
we are out of Zephyrin.
okay. Do you want more alcohol?
Yes, please.
Okay.
So these are all like soapy now.
Yeah, we mixed.
They sat, I think, and soaked it up.
Here you go.
Thanks, man. That's better. I think those are just soaked up enough Gorax that they were just
Yeah.
sudsing. You're so cutie.
Oh, his pulse socks.
Oh. Sorry, you got soap on your peen.
Better that way.
It's clean now. Okay, and then we'll put,
That's because he's well endowed.
you're right. We'll put the mixed one on. We'll put the mixed one for contact time, right?
Yeah.
Why not?
Yeah.
Then you're extra sterile. Okay, there's that.
All right, buddy.
Beautiful.
And then,
Yeah, you got a scrub for that too.
I know. Do you want
If you want to block testicles, you can.
that done first?
Yeah.
Okay. Do you
Do
just
you
want
need
half
that
and half?
part-
Yep.
Do
That
you need
sounds
that
good.
part recorded as well, or?
I don't really care. I can edit it.
I mean, the video is already like
13
over 10,
minutes.
Yeah.
it's okay. I can edit them.
Okay.
Okay. You're okay with the 22?
hmm
And then you just give up here, right?
I actually go into the bottom.
You go into the bottom.
Yeah, so like I'll literally kind of like grab one and then just literally go right in.
Okay, and you just go right into the.
Mhm.
Okay. Wentworth told us to go up here. It's into, like,
When
the
I was in school, they
spermatic
told
cord.
us to go into the
In
testicle.
into the testicle.
Yeah.
That's what I was taught originally.
Wentworth is weird.
Just half. Yep. Yeah, Wentworth was like, yeah, just give.
And then you're supposed to like hold it. So yeah, for the hematoma. I don't know. They like in school they were
Sometimes
like,
they get hematomas.
yeah, they were super worried about hematomas when we did it in school, and I was like, you're taking it off. Why does
Right.
that matter?
Yeah.
Unless they get a scrotal hematoma, that makes sense.
I guess.
But normally, like the testicle itself will get a hematoma.
Oh, really?
Mm-hmm. I'll get a giant bruise on it.
She said the cord because it numbs everything. I don't know.
How do you know you're hitting the cord and not just going next to
Because
it?
I guess you're just hitting the nerves next to it.
Oh, okay, and then it just does everything.
Yeah.
Blocked.
Hey, come back here.
He said.
Oh, these have grippies.
Ooh.
Like fingerprints.
Yeah. Okay, get back out there. Okay.
Can you take this back for me?
Mhm.
I have to give him breaths again.
I feel like I'm just like
recording dog porn now.
It's okay. Okay. It'll be alright. Alright, starting his scrub. Give me.
His lungs inflate, and I don't see anything up in his neck up here, so I'm pretty sure you're in.
Yeah, because I was watching that when he was breathing too, and I think it's in. He just
said, I can't do this anymore.
I'm surprised his heart rate's that low with the Medaz on board.
Well, he is on 1.5. I could turn him down. Well, it's the ketamine that's helping it to still be low.
I
And
think
Dex.
he's on Dex too.
I was
I'm
gonna
like,
say.
I'm actually surprised it's that high with the Dex.
Yeah, maybe that's why, because most of the time when I see people do healthy dog, they don't do Dex.
They
Yeah.
do ACE, yeah.
Yeah.
They do ACE, and the ACE doesn't do shit for.
Right. Well, that's what I told him. He
Wow.
wanted to do ACE, and
Hi.
I was like,
No,
no.
not in this kid.
We'll try him at 1. See what he says. Maybe that'll make him breathe.
Oh, I'm not alternating. Hang on.
Edit.
See, to me,
What?
it increases your contact time.
Oh, not alternating? I agree.
But I was taught to alternate too. But I'm like, I'm just wiping it off immediately.
Yeah. It's like they said like scrub rinse, scrub rinse, scrub rinse.
Look at all the meaphine in there.
I know they're getting to know each other. They're ready.
Are
go
they
ask
bonding?
them
What
if
are they
they're doing
talking
yoga?
about?
Maybe they might need to do more
They
yoga. Are they doing yoga? Tell them we need to make sure that they're still limber. I don't want them to get all stiffened up. He's stretched out. He's ready.
He's ready. We're almost done. Sorry.
His teeth are keen except for his
His one
molars.
canine looked angry.
Oh, actually, you're right. I agree. He's kind of like grilled cheese if you were a dog.
You all right there, buddy?
Yep. You're walking.
Reverse.
You're walking so fast. Slow it down,
also
Buster.
tour, so I didn't really want to just stand up.
Okay. Get your soap.
You didn't just shove them out of the way or anything.
I tried.
You didn't want to just shove them out of their
I don't
body.
The fact that that's
understand.
my Walmart videos, I think the best part.
We've said all kinds of things on this video. They don't care as long as I know what I'm doing.
I said it looked like we were
Yeah, because
we were
Simon had
videoing
to
dog
talk about one of
porn.
his dates.
Yeah. They don't care as long as they know
Clean.
what I'm doing.
Clean.
Hey, stay where I put you.
All right.
Okay, two thumbs up.
If I'm doing
There we go. Okay.
You're gonna make me do that after all my. Okay, sorry guys.
She's impeccable. She asked
I was
her.
gonna say, did we give an explanation for this?
We're just making a TV show.
Yeah, this is for our YouTube channel.
It's gonna be like The Office, kind of.
Yeah. Okay. So they are very
Ew.
specific. They're very specific.
Okay, that's fine. They're specific probably because it makes them clean.
Yeah, pretty much.
This is a nice technique. I've never seen this before.
This is
I
the
only just see it on the
racetrack.
What do you mean you've never seen this?
The surgery suites I'm usually in, they're just like,
Oh.
Yeah, that's most standard practices. I'm going to Penn Foster, and they, because it's online, they want you to be like all of your externship skills. They're very specific because it's online, so they want to make sure that
Yeah, you're doing it.
you know what you're doing because they're accredited. They can't lose their accreditation, so you have to be able to like know what
I
you're
was
doing.
gonna say, do you want us to do that one yet?
I don't know that I would.
You don't probably have to, Bree.
Oh, you're gonna do the first one?
Yeah, I think
Oh, okay. I don't know what
just since it's kind of the two more sterile procedures,
I'm just gonna do one more for the sake.
Yeah, you're here. We'll just do it again later.
I usually text you from this side. See how you feel though.
Yeah, because I was gonna say, just for like the, like usually, what
Yeah.
I was thinking was to do the.
Okay.
Okay.
And then getting down.
Hi, buddy. Sorry about your newbies. He's a hairy guy.
It's cute little fuzzy nugs.
I know, right?
You got edit out the audio. I'm assuming.
called them pom
Oh no, we have to leave the audio.
Oh.
Yeah. You wouldn't imagine some of the stuff I've submitted. Yes.
Well, I work here, so yes, I would.
Some of the other stuff that oh, well, you, but also Stamba was like manhandling a dog's penis on one of them. She's like, "Can you edit that out?" I'm like, "Nah, buddy. Whole thing's gotta stay."
Yeah.
As long as you don't lose points for us being unprofessional.
No, basically they just need to know that I'm competent.
You're like, good job, but where the heck are you working at?
Honestly, it's vet med. Like they have to know that we're all.
I think they're gonna be surprised we're not dropping it.
Yeah.
Well, she doesn't hang around me with that camera very well.
We got time.
We could all
We got
drop it right
time.
now and sign.
All right.
I'm the worst when it comes to my potty mouth. My grandfather was a race car driver. I have multiple
nice.
family members in the military. My husband worked construction for like many years, and now he works on the railroad, which is 10 times worse.
Yeah.
How do you feel about that? You like that?
Maybe get a little bit more top and bottom.
So yeah, I've always had a potty mouth.
It's the unwanted bikini
that's
wax.
Irish. From Ireland. I go back and everyone's just saying the C word all the time. It's crazy.
Really? Where's
Oh my
this?
god.
Ireland.
Oh.
Oh my gosh, that's
yeah,
funny.
They say it's
Ireland,
Scotland
Australia.
too.
Oh yeah, that's true.
Craziest thing.
Isn't it funny how different areas use like different curse words frequently? Like
Yeah.
I feel like the U.S. likes the F-bomb and
Yeah.
Well, it's funny because in the UK, heck is like terrible. It's not a good word.
Oh yeah. Well, in Ireland they don't say that. They just say feck.
Yeah.
Like how the feck is that?
So funny. I've been to England, but I've not been to the rest of the UK.
Oh, terrible.
That's
country.
6 minutes.
I'm just kidding.
I had fun.
That's
I
nice.
rented a car and yeah, because I had driven it. Yes, drive. I was coming from St. Kitts, so it
Okay.
was easy. So I rented a car and then drove around looking for wild ponies. And it was so fun. I found them.
do that. I would love to do
that would be so fun.
They were like sheep in the middle of the road. It was really
Oh, that's
cute.
fun.
Yeah, I went out to Exmoor.
I feel like once I graduate, well, it depends or not whether I get like a rotating internship where I want to go, but I think it'd be cool just to take a little month off, just go around the world.
That'd be good for your mental health too.
Yeah, I just did when I was
What do you
teaching
think?
it. That was great. Yeah, I was teaching at Ross. I did like as many international CPs as I
Oh,
could.
thank you. Lovely. Okay.
Have you seen like the really cool like the missions that students can do in like Africa and stuff?
Yeah.
I went to Nicaragua every year. I took a group of
Oh.
students like 6 or 7 years running.
That's so cool. I wish they did something for techs like that.
Yeah.
So Christian Veterinary Mission does if you want a faith-based one, but
Yeah, I have I'm like a member of them, but
I'm going to a high. My girlfriend and I were going to a high-spay von neuter clinic in Spain.
Oh, yeah?
Nice.
That would be cool.
You
tell
know-
who came up with that idea.
Not because I was looking or anything, but the ASPCA is hiring technicians to do disaster relief.
oh really?
Wow.
Yeah,
I just saw
they're
the.
paying upwards of $32 an hour.
Tucker's anesthesia sheet is.
You know what I saw was
No, I brought them in
On the
here.
table,
Oh.
maybe.
the government is
on, like,
hiring
Yeah.
where all
like
cabinets and stuff are.
level 1 secured, like you have to be approved and background checked and all this stuff.
What if you already are? I am because I
Yeah.
already work for the feds.
Yeah, they have positions that where you work with like bomb dogs and stuff. I saw it listed. You have to like be able to travel to, I think it's maybe Virginia, but it's remote mostly. So it's pretty cool though. Like that would be sweet.
I would like to do the disaster relief.
Pretty cool.
The Delaware County Humane Society is hiring for a new vet, and it's a lot more than what I'm making.
I've already worked there.
I was kind of tempted, except that it's fine.
Yeah.
It is so influenced by their board members, and their board members are so breedist, and they're also so full of themselves that they made my job 10 times harder.
Oh, I believe it. They, and this was probably 15 plus years ago, they had a board president or board director, or I can't remember if it was the director or if he was on the board. He was married.
We're gonna go a little higher because you're getting a pexy, so we're gonna go even higher than your xiphoid because they like to shove their little arms in there. Oh, I forgot to say hi, I'm Bree, here's my thing. Gosh, look how prominent her vessels are. That's crazy. It's like mowing the lawn. Thanks for the cleanup crew, Michelle.
I'm your badger. You don't want to take this in surgery.
No, we do not.
Now it's become a game.
I know, right? How?
Who says we can't have fun in Bethlehem?
Oh, I know, right?
I think we have fun, generally speaking.
We do have fun. I think so.
We have a great team.
And I'm just gonna come out and say it now. Every day's gonna be like.
I know, right? I kind of told Marty yesterday because he was like, I'm out tomorrow and I feel kind of bad because of everything. And I was like, honestly, and he said, but honestly, I think you guys have some things to look forward to now. And I was kind of like, he's like, that sounds terrible. I shouldn't have said that. And I was like, well, if I'm honest, you know, it's not like he missed that on his normal days off, you know, like, and when he was sick, like, we didn't miss it.
No, we covered his shift and moved on our very little way.
And I told him too, sometimes like he would make it harder because we would have to do his job and our job and then also help him do his job, and it was just
And we could just go ahead and do
extra
it.
work, right? It just became extra work. Your hair grows in every direction, my friend.
That's because she's a diddle. Blood pressure cuff's not reading.
I'll move it over here and I can hold her down.
Ooh, she got stinky cheeks. She's nice and skinny, so her ribs are real prominent. That's pretty good. 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 Looks good to me. Okay. Yes. Oh, who unhooked it?
Whoever wants to see you crawl on the floor. There's the little things in life.
I don't want to be vacuums at home.
Yeah, it'd be nice. This is the only dog hair I have put around my house.
Have you seen like houses? They don't do it anymore, but they used to do the central vacuum.
Yeah.
Hey.
I liked you so much it was gonna take you with it.
Oh no, apparently.
Hi, honey.
Hi.
How are you?
Good. How are you guys?
We're all on cloud nine.
Line block before
Well, okay, I don't want to
scrub.
say it like
Where'd
that.
that go?
Yeah.
We're having a very
not
good day.
Upset.
We're having a very good day.
Light
Light
a
a paint.
Does that sound better?
What'd you say?
At first I said that we were on cloud 9, and I said didn't want to sound mean, so I'm saying we're having a very good day.
Yeah, it's just like, I just feel kind of bad.
I mean, I kind of do too, but he brought it on himself.
I know.
And I wouldn't feel too bad. Remember, he took pride in telling us all about how his wife is loaded.
Well, and his, yeah, I think about, like when I start to feel bad, then I start to think about like all the things that he said that were like really terrible. And
He was always bad-mouthing his wife.
And like,
so
if
good.
things
She's
were
too
going
good.
on that he could have talked about it.
well, and
Not
that's
just at the end.
That's the thing is, I said to Janie, I was like, you know, even though maybe he wasn't set up to succeed initially,
Yeah.
he also had 2 years of feedback
Yeah, he didn't take any action
To-
to do anything.
fix it. So
He just pretended like he knew what he was
I
doing.
think
Right.
Joe said it best this morning. She said that he kind of paved his own way
Yeah.
and then
refused to
became
change.
very stubborn to the idea of change.
Yeah.
Because he was set in his ways.
I don't feel like I feel bad for him just knowing
No.
all of that. It's unfortunate, but it's totally something that he could have
Right.
done something about, and he just
He has
didn't.
had multiple discussions with the higher ups and HR,
That's
and
good.
they gave him
Like
multiple
that.
opportunities.
Sharps. Scrub.
Is she doing you guys failing her?
Yeah.
Good, you should.
I know.
No, we can't. We need it back.
We have a tech. Are you gonna be the assistant manager now?
I should.
You should.
We're applying for it.
Yes, you should.
I think me and Michelle are weird. We're not doing anything like the first time around when they brought up the lead assistant job where
Yeah.
everybody was like fighting.
Yeah.
Me and Michelle are like, are you doing this? Have you done that?
Have you got it in yet?
It's not like
Should it was,
you're
you
in
know,
competition with each other, it's gonna go to.
It's gonna go to
Whoever
whoever's,
they feel.
yeah, whoever they feel is a
You
better
guys
fit.
could be co-assistant.
See, we thought
Right?
about that. She could
And
be
then
the
it would be
lead-
like a checks
she could
and
be the
balance
manager,
system.
and I could be the lead tech, because I
Yeah.
like to be on the floor.
They could
And I
go
don't like all the
scrub?
paperwork.
Sorry? Yeah.
And you don't like to do all the bad things, so.
Exactly, like firing
love to
people.
fire people.
Yes.
It's not
Right.
firing, it's termination. You need a hat mask.
Oh, yeah.
Nope, okay. Come on, this is on camera.
Michelle, are you gonna be like dictator, like you're fired, you're fired.
You're
I'm not gonna
fired.
fire anybody because everyone's gonna
Me?
be great at their job
I-
and.
You're gonna train.
I
people,
said
right?
that she could be the manager, I could be the lead tech, and then then it would be like a family affair, because Dr. Snyder is up, like, with the faculty, and then her and me, we're all
Whole
cousins.
checks and balance.
We're all cousins.
Well, I'm so mad they didn't let me do what I
Dr.
wanted to
Snyder's still
do.
looking over the family
Where I could
tree,
go in
but
the conference
all of
room
our
and be
families are
like,
from the same
you're
area.
fired.
So we compared our
Like,
family tree,
oh, excuse me,
and
alternating. Michelle.
they are the same in some areas.
You guys should just hire me and I could quit that school.
Oh, come on. You shouldn't have left
You
in the
work
first
so hard
place.
to get.
I know, I have to tell
No,
myself
we're not
that.
gonna do
I
that.
have to go study for an exam.
I mean, you
exams,
could
like,
always
every
just go to
week.
tech school.
Yeah.
We need more technicians. Like,
What if I'm a
in the
vet
entire field,
And
period.
a technician. I
Yeah,
can
do
be
that.
Is he scrubbing already?
I told him to.
Tevin is doing that right now, like he's in tech school and he's in undergrad.
It wasn't
Goes
Blair's
vet school.
aspiration.
It's like,
Well,
dude.
following Skylar.
It was.
Okay, I really have to go study because I don't know anything for my exam.
Yes, you do. It's in there somewhere.
Yeah. You got it, you got it.
Any of the cranial nerves, like what the F is the trigeminal? I know I literally just remember
Number
this
5.
here, right?
See, right there.
There you go. She'll answer the questions for you.
Why is it called
I just had to
trigeminal
ask
if it's number 5? Shouldn't it be quadgeminal? No, that's 4.
No, because it goes to 3 places.
Oh my
1,
gosh.
2, 3.
Well, that sounds like they named
See,
it
it
wrong.
seems like you know it.
That's because Dr. Matsuki told me over there because she asked me what it was and I said I have no idea.
Well, see, you're
See,
learning.
you're being quizzed everywhere you go. You got incredible teachers everywhere.
Bro.
Which nerve helps with vision?
Oh, I know this one.
I do too, but I'm not
It's
answering.
easy.
Motor makes it new. I don't know.
It's easy. Come on. What do they look at when you go to the doctor?
Optic nerve.
Yeah, buddy.
Yeah, but that's not one of the big.
wait, yes it is, it's number 1. It's multiple choice and I only have to get 65%, so I think.
Oh my gosh, you got this.
Okay, bye guys. See you when I
Bye.
love you.
Good luck.
Oh, I'm sorry, kiddo. I need your skin so angry. I don't know. So it's clean. Maybe she's clean. Yep, looks good to me. Okay. I'm gonna put a.
Go grab my mask so that I can put you into the surgery suite. Are you in surgery now?
Yeah. Miss the cat news.
Okay.
Hello. Can you take this one? And this one.
Okay. Should you boy wearing gloves?
I don't think so for this one because I'm not actually touching.
It's on a wand, so if it wasn't on a wand, she probably would.
Yeah, probably.
If it was like in a bowl, sterile glove.
Fill it up. There we
I just don't
go.
know their particulars.
I know.
I said something earlier. This is set brief, you said?
Yeah, she preset it.
I did not set the rate because I wasn't sure of what it was.
But so far, 25 looks kind of 93. That sounds
I
better.
was going to, but then I didn't check it and I forgot. That's probably high.
Hush.